Okay, good day everyone. Welcome to our standard first aid module. This is in connection with your emergency management module. So this is named by IHL as your emergency management 2, wherein you're going to receive separate grade out of this, separate from that of your emergency 1. So again, for those who are new, 50 to 60% would be your skills, 20% would be your final exam, and 20% would be the quiz, and of course your attendance, grooming, and of your um uniform would be 10%, total of your 100%. So we're going to start with your standard first aid equipment. Here are the listed equipments. So we have your spine board. I'm going to show that to you. It would be a big board made only for your first aid. This is used for clients with possible spinal cord injury. Another, we also have your short board or Kendricks. So just like all of this, it is used to immobilize the area. Extrication device, sets of splints, poles, and your blanket. Okay. So actually, as a caregiver, you would only we are just teaching you on how to do basic splinting, basic first aid from the word first aid. So kailangan yung, for example, if you will be given a chance to perform a certain procedure out of time na medyo mabilisan o kailangan unexpected procedures. So that is why we have this emergency management too. Suggested first aid kit contents, we have your rubbing alcohol, povidone iodine, so we have your betadine, and then we have cotton gauze pads, tongue depressor, pen light in case if you were going to use it kung walang adequate light, and then we have band-aid to at least for aesthetic reason. Kailangan kasing, for example, pag may wound, kailangan kasing hindi siya visible. So that's why you have to apply band-aid. And also to cover the wound area. Plaster, okay. Then we have your gloves, scissors, forceps, your triangular bandage, elastic roller bandage, and occlusive dressing. Okay, your gauze pad and all. Okay, number 3, we have your cloth materials commonly used in first aid. One is your dressing or what we have as your compress. So this is your dressing defined as any material, any sterile cloth materials used to cover the wound. To dressing, pwede ring any clean cloth will do. Other uses of dressings or compress, we have to control bleeding. So remember this ha, anong gamit ng dressing natin? That is to control bleeding, protect the wound from infection, absorbs liquid from the wound such as blood, plasma, water, and your pus. So, and we have your kinds of dressing. One is your roller gauze. We have that one, yung nakapak na po. Anyway, I'm going to show you this one tomorrow or during our first meeting. Square and iPads or iPods, compress or adhesive. So in application, and then we have also before that, we also have your compress or adhesive, we have occlusive dressing and your butterfly dressing. So compress or adhesive, occlusive dressing or your butterfly dressing. And application, we have completely cover the wound. Avoid contamination when handling and applying. That is why you need to wear gloves in dealing with your wound dressing. Okay, next is your bandages. Any clean cloth material, still sterile or not, used to hold the dressing in place. Okay, so that's your bandages. Bandage. So usually we have a over the counter na bandage yung ginagamit for ano ba yun? Yung ginagamit for IVF or intravenous fluid administration, and of course your wound dressing. So other uses of bandage, we have to control bleeding, to tie the splints in place, immobilize body part, and for arm support or use as a sling. So we have here the purpose of your bandages. We have kinds of bandage. You will be provided with your triangular bandage, which has 4 tail, or the cravat bandage used as a muslin bandage binder, and then we have the roller elastic bandage. Okay, so triangular bandage, bibigyan po kayo, or I hope you already have one. Application must be proper, neat and correct. Okay, and this tie the splints in play, so must be proper and correct, and then apply snugly, not too loose, not too tight. Okay. So, hindi pwedeng maluwag, hindi rin pwedeng masyadong mahigpit. And then always check for tightness because it may cause later swelling. Pag masyadong tight, so it will going to cause inflammation or your swelling. Tie ends with a square knot para madali nyo pong ma-remove. Okay, in case nga you were going to do proper dress. So we have now your triangular bandage. Usually made from a 45 to 50 inch square piece of cloth. So I guess you already hold your bandage by now. Cut from one corner to the opposite to form a triangle. Can be folded to form cravat, broad cravats, or narrow cravats. So this picture here, this is known as your triangular bandage. Okay, this one. So this here, ano bang kulay nito? This one is your roller bandage, ito. And ito rin yung iPads nyo po, yung square iPads or your rectangular iPad. And we have your band-aid here. Ito mga roller bandages po rin, din po ito. Sizes na may sizes. Okay, so these are your bandage ha, 45 to 50 inch square. Okay. So we're going to teach you how to fold your bandage anyways to form your cravat and even your narrow cravats. Broad cravats and narrow cravats. Okay, cravats. Okay, so this is now yung tying a square knot. Bakit kailangan natin yung tying square knot? Para madali natin siyang ma-remove in case na dapat na siyang i-remove. So, in tying, and your first is, you will going to pass the left and the dark one. So, as you have seen, ito pong dark one, over and under the right. Okay, then bring both ends up again. And then pass the right end dark over the under the left. And then pull the ends firmly to tighten or tuck ends. That is your square knot. Para hindi kayo maguluhan, yan nyo na lang. Remember, kung ano yung ginalaw natin na side, yun at yun pa rin ang gagalawin natin kahit saan man siya mapunta. Ma-either left po siya or ma-right. Copy? Okay. So, or isa pa, kung ano palaging nasa taas, siya pa rin ang nasa taas forever. Hindi pwede yung nasa ibaba, the next time, magiging mataas. Nasa taas na po. Hindi po totoo yun. So, dapat yung mas mga mataas, dapat nasa taas na siya. O, palagi. Okay. And then pull in removing or untying a square knot, pull one end and one piece of bandage apart. Okay, and then hold the knot, pull the end through it and out. Okay, madali lang i-remove yung square knot. So we have here your soft tissue and specific body injuries. So sinama ko siya para medyo magkaroon kayo ng background. Anyways, you will be dealing with this with your basic infection control too. Okay, one is we're going to define first a break in the continuity of tissue of the body, either internal or external. That is your wound. W-W-O-U-N-D. Here, this is the wound. Classifications of wounds. One is closed wounds. Closed, may D po. Involves the underlying tissue without break or damage in the skin or mucous membrane. So, wound, pag sinabi natin closed, wala po siyang opening. Kasi nga closed, di ba? So, it either yung nasuntok ka sa mukha. Nagka-bruise lang po yung face mo, so that is your closed wound. Causes, we have blunt objects results in contusions or bruises. Application of external forces such as motor vehicle accidents and your fall. Wala pong opening si wound. Kaya tinawag siyang closed wound. Okay. Factors or other injuries which may be involved. One is damage beneath the epidermis, depends on varying depth. Okay, depende po yung kung ano kalalim yung close wound nyo po. O anong mga organs na na-involve or meron ba? O muscles lang po ang involved. Depending on extent of force, cells are damaged and small blood vessels are usually torn. Okay, pag sa wound, usually small blood vessels ay matorn po siya. Varying amount of edema fluid and blood leak into the damaged area. And of course, pag closed wound, there is a possible fracture. So those are the factors or other injuries which may be involved. Then the signs and symptoms. Of course, pag may fracture, di ba, pag makakita kayo ng patient na na vehicular accident, ang i-remember nyo po, di ba, circulation, we have your ABC or your CBA, circulation, breathing, and your airway. And then the fourth one is your pain. Okay, may masakit ba? May masakit ba sa kanya? Because pag may masakit, you have to check it for fracture. Okay, next is symptom swelling. Okay, swelling po. And then discoloration, or there is black or blue, which is called ecchymosis. Okay, called black or blue discoloration of the skin, that is your ecchymosis. O ecchymosis po siya. Hematoma may occur or pool of blood collected within the damaged tissue. And uncontrolled restlessness, syempre, pag you have something, if you are hurting, so of course you will become restless. So how it would be manifested? O hindi po mapakali yung patient. Okay, sabi wag igalaw, ginagalaw. Okay, di ba? Wag mo pong igalaw yung kamay nyo. Okay, tapos yung eyeball niya po palaging nagro-roll kasi increased anxiety level. Thirst, o inuuhaw, symptoms of shock. So, ano po yung symptoms of shock? Decrease po yung vital signs. Vomiting or cough up blood. Passage of blood in the urine or feces. And of course, signs of blood along mouth, nose, and ear canal. So these are examples of your discoloration, closed wound. We have here, di ba? Wala pong opening ha. Eto, wala pong opening, sarado po yan. But that is sure there will be hematoma formation o may dugo po na ano dyan sa iloob. And then we have the closed wound. First aid management. So you have to memorize the acronym ICES. One is ice kung closed wound, ice application, then compression, then E for elevation, and the last one is your splinting. Okay. So ice application, ice or cold packs can be effective in helping control both pain, swelling, and cause the blood vessels to constrict, which will slow bleeding. Diba? Yung ice will going to slow bleeding kasi mag-constrict po yung blood vessel. And of course, pag kinonstrict mo yung blood vessel, si pain sensation po ay magdi-decrease. Decrease. And the next, we have compression. Manual compression over the area of injury will compress the blood vessels and also decrease the bleeding, of course. Diba? Pag kinompress natin, hindi magdi-decrease po si bleeding. And elevation. Elevating the injured part will decrease the amount of swelling. Diba? Kasi yung flow ng blood is by gravity. So, dapat in-elevate natin siya para hindi bibilis yung flow ng blood. So, kung hindi bibilis yung flow ng blood out, so blood loss will be prevented. Diba? Or you are now controlling your bleeding. And in case of closed wound, so definitely, there will be decrease in elevation, there will be decreased pain sensation. And then we have splinting, immobilizing the soft tissue injury. With a splint is another way to decrease bleeding. Okay, then we have now your open wound. Okay, so open wound is there is a visible break in the continuity of the skin or mucous membrane, or the protective skin layer is already damaged. So classifications, we have now your punctured, dito, paa. Pag sinabi natin punctured, so usually penetrating pointed instruments such as nails, ice picks, daggers, etc. So, ito po. Nail po ito. Deep and narrow sears or slight bleeding. Okay. Ang problema sa ice pick, yun ang grabe. Pag na-ice pick ka, di ba, rounded po yung ice pick, just like your nail. Kaya lang yung nail, may ulo, yung ulo niya, hindi pa yun. Yung tip niya po ay may shape. So, hindi po masyado makapenetrate si nail sa loob kasi may shape, di ba? Medyo may ano siya, may shape nga. Yung may rough portion. So, hindi makapenetrate. But yung ice pick nyo po, rounded, tapos very sharp, and then very smooth. So, if it will be applied to you, so definitely, of course, and then removed after application, so automatically the wound will going to close. So there will be internal bleeding that will going to occur, and you will not know that there is a wound because the wound closes, diba? Once it was pulled out, especially the dagger will, the ice pick will be pulled out, the wound then closes. And then next is your abrasions. Abrasions are scraping or rubbing against rough surfaces. Okay, so this one, or sa in Bisaya, pa this is your gas or garas. Shallow, wide oozing of blood, and you're considered to be dirty. Okay. And then next we have lacerations. Lacerations are wound of irregular edges. Okay, just like just like this one. Okay, marami pong na-torn na wound, di ba? So, irregular po yung edge. Blunt instruments such as sharp nails, rocks, broken glass, etc. So, marami pong blood vessels ang nakat. So, torn with irregular edges series or slight bleeding. So, you should apply, aside from those mentioned, your splint and your what they call this one, it is the must for you to suture wound pag lacerated. So, to suture, tahion. And then we have your avulsion. Ito po kamay, natanggal po yung part na po ng ano. This is a cause of your explosion. Explosion, animal bites, mishandling of tools, etc. So, that's your avulsion. So, avulsion, kung man sa pa, gawas ang pari o gawas ang unod. So, tissue forcefully separated from the body. Okay, that's your avulsion. And next is incision. So, there are sharp bladed instruments such as blades, razor, etc. Okay, nasama the blade, the incise. So, clean cut, deep, or severe bleeding wound is clean. Okay, so we have there, ha? So, the danger, we have your dangers. Okay, dangers. We have your hemorrhage, loss of one glass, approximately 250 cc is normal when it comes to your open wound. But if you're going to increase the blood loss to 2 to 4 glasses, victim becomes anemic, and of course, it will going to predispose the patient to infection. And pag grabe na, 4 to 6 glasses will be your fatal. So, it need now your transfusion. Infection, one, delays the healing of the wound, and it will going to lead to gangrene or marag malataang area. Excuse me. And even amputation will be necessary to prolong the life of the person. And sometimes, your infection may also lead to unnecessary death. Okay, sepsis na yung cause of death dayon. And the next is your shock. Your shock, so of course, pag shock, yung vital signs nyo po ay bababa lahat. So, it will predispose the person to infection. So, balik tayo sa infection. And we may result to loss of body part. And because of balik tayo sa infection, it will lead to unnecessary death. Or the cause of death will then be sepsis. Kinds of bleeding. We have now your arterial bleeding. Occurs from the word arterial. So, artery po yung na-open. Characterized by irregular spurting of blood. So, irregular spurting of blood. So, meaning, may mga source of blood na parang nag-ooze. Tapos, marami pong points. Kung pag nyo po, in-apply nyo ng OS, makita nyo po na marapito siya nagtubod ang dugo. That is your artery po ang na-hit natin. Pero pag vein naman, or your, what we call as venous bleeding, occurs when the vein is severed or punctured, characterized by an even flow of blood. An even po, meaning even, pareho lang po yung flow, di ba? Hindi mabilis, hindi rin po mabagal. Okay. So, for example, you have noticed pag sinabi na, ano ba yun? Bulanon, or no, taob. Oh, taob, sukusog ang dugo. No! You have hit an artery. It doesn't have any relationship to the taob or to the hunas. Ang alam natin, dapat malaman, pag masyadong malakas yung dugo na dumadaloy, so you have hit an artery. Pag mabagal yung flow ng blood sa wound area, meaning, ang na-hit natin ay vein. Okay. Pag capillary bleeding or yung mga area na malalayo po sa, let's say, your fingers lang. Kasi your toes, it has capillaries. This is described as your capillary oozing. This type of bleeding is expected in all minor cuts, scratches, and abrasions. So, anong capillaries bleeding? Makita mo naman yun na marami yung nagbi-bleed. Just like, for example, abrasions, di ba? O, di ba? Marami sila na may point-point na red. So, capillaries po yung na-affected. Okay. Yung capillaries, either your arterioles, kung arteries yung na-hit natin, or venules, kung vein naman yung na-hit natin. Now, we were going to do first aid. So, you have to follow the 4C. One is control the bleeding. Okay. Direct pressure may help for controlling the bleeding with the use of a compress or a sort of cloth. Then pressure is applied directly over the wound area and can be applied to any kind of bleeding and to any body part. Do not apply direct pressure on the eye. Of course, bawal po siya sa eye ha, yung pressure. Wound with embedded object, yes, pag may example, abrasions, tapos may mga dust pa po siya, in-applyan nyo ng direct pressure. So, pinasok nyo si dust sa skin area nyo na much deeper, di ba? Much deeper. And it will not cause infection. So, make sure you're going to wash it first or wash it with running water. Another head injury with possibility of skull fracture. Okay, because direct pressure to the skull affects the brain. So next is elevation. Elevation, raise the bleeding part above the level of victim's heart if you don't suspect a broken bone. And if elevating the injury doesn't cause the victim more pain. So dapat i-elevate natin siya by controlling bleeding. First, apply direct pressure, then elevation. And then the third one, pressure point, bleeding control or your pressure on supplying artery. So if direct pressure and elevation don't control the bleeding from an injured arm or leg, compress the major artery that supplies the blood to injured area. While pressure is applied while direct pressure and elevation are maintained. So we have there your hakarapit magkuha na to. Atop sa mga pressure points sa mga dagko nga blood vessel nga sila supply sa area. For example, lang bleeding sa imong arm, kani, imong forearm. So you're going to control it with the brachial artery. Okay, so by doing this, you may apply pressure on their biceps and triceps, diba? And of course, this includes now your tourniquet application. Okay, hiktanin mo siya ang area para mo stop ang bleeding. Okay, and then femoral artery or in the groin on the top of the leg bends for leg injury. So either your brachial artery or femoral artery. So this will be now your tourniquet application. How would you spell it? Tourniquet. Tourniquet. Letter C is cover the wound with dressing and secure with bandage. That is how if you have already cleaned the area. Wala na po embedded object. And take care of shock. So how would you do that? So, paano maiwasan yung pag-decrease ng vital signs? Of course, you should decrease the anxiety level of the patient, monitor the blood pressure, and of course, you are going to ask the patient to drink water, or at least to calm down the patient. Okay. And consult or refer to the physician. Again, one is control the bleeding, cover the wound with dressing, care for shock, and consult or refer to the physician. And in care for shock, if the patient is lying down, you have to elevate the legs. Elevate the legs of the patient. Simple bleeding wounds. Clean the wound with soap and water. Apply mild antiseptics and cover the wound with dressing and bandage. So reminders, all wounds must be thoroughly inspected and covered with a dry dressing to control the bleeding and prevent further contamination. Once bleeding is controlled by compression, the limb should be splinted to further control bleeding. Stabilize the injured part, minimize the victim's pain, and facilitate the patient's transport to the hospital. Okay, these are the things that you have to do. As with closed soft tissue injuries, the injured part should be elevated to just above the level of the victim's heart to minimize severity. Amputated body part should be saved. Wrap it in dry gauze, place it in a plastic bag, kept cool, and transported with the patient in the hospital. Example, yung finger niya po natanggal. So, i-wrap niyo po siya, i-soak niyo po with cold water na may ice. Do not induce further bleeding to clean the wound. Yes. So, meaning, pag sinabi natin do not induce further bleeding, hindi po pwedeng paduguin natin, paduguin natin yung wound. Do not use absorbent cotton as a dressing kasi may fiber siya na malalaki. So, it will going to stick to the wound area and it will be now interpreted as a foreign object. Now, you would notice that your wound now will become inflamed. So, dapat yung gauze talaga. Dressing and bandages. Guidelines in using the dressing and bandages. Skin is not sterile, remember that. That is why if a dressing slips over the victim's skin while you are trying to position it, discard and use a fresh one. Of course, dapat pag nahulog yung dressing, dapat i-discard na po natin yon. Hindi po natin pwedeng gamitin. And then place the dressing over the wound again and don't slide it into place. Use a dressing that is large enough to extend at least 1 inch beyond the edge of the wound. So, dapat the wound should be completely covered. If not 1 inch, 1 inch. If body tissue or organ exposed, cover the wound with dressing that will not stick, such as plastic wrap or moistened gauze. So, then secure the dressing with a bandage and adhesive tapes. If the bandage is over a joint, split and makes a bulky dressing so the joint remains immobilized. Immobilized. If there is no movement of a wound over the joint, there should be improved healing and reduced scarring. Scarring means, sa may scarring be? Kanang, ano ba, pag murag, scarring ka ng, murag, friction. Pag-apply of friction causing now your scarring. A bandage should fit snugly but should not cut off circulation or cause the victim's discomfort. If the area beyond the wound changes color, begins to tingle or feel cold, or if the wound starts to swell, the bandage is too tight and should be loosened up. Okay. Dapat hindi po siya masyadong masikip. Bandaging techniques depends upon the size of the location of the wound, your first aid skills, and of course, the materials at hand. Okay. Next slide now would be your bandaging techniques. So here are your bandaging techniques. Okay. So we have here your triangular bandage. So you're holding yours already. We have now your open face. Your open po yung open. So, I'm going to teach you on how to fold tomorrow. And you have to do this type of bandaging. The open face. Tingnan nyo open, no? Malaki po yung, yung bandage. So, we have, in up face, you may do head, top side, face, back of the head. Another is the chest or back of the chest, and of course your hand or foot. While your cravat face, we have the forehead, the eye, the ear, cheek and jaw, shoulder or hip, and then we have your arm or leg, elbow or knee, straight or either bent, palm pressure bandage, and palm bandage of open hand. So that's it. So I'm going to show you pictures of that. You have that one in your handouts. We have here also the roller bandage, either spiral, open or closed, spiral reverse. Okay. So head top Ito po yung head top side ha, open face. So kanina yung head top side, and then we have now your face and then back of the head. Ito po yung face po yung may cover. Ito po yung back of the head. Oh, pero pareho rin po siya. Ito actually back of the head to eh. Oh, pero pinakita as a example kong face. And the next, and so this one, open face, your hand and foot, and chest, back of the chest here. And then we have also chest or back of the chest, shoulder and hip. Yan po. Actually, pag hip na, mahirapan tayo kasi maliit lang yung size ng bandage. And now, we have your cravat face. You have your forehead. So, you would know that kung saan po yung injury, dun po si thigh. So, basically, nandito yung injury. So, nandyan po yung thigh natin o yung square knot natin. So, ear. So, pareho lang. Cover po siya. And then we have also cheek, this one, and even jaw. Pareho lang po sila. And then arms, and then your legs. The arms, and then the legs. That is now your cravat. And then open arm. Open arm. So, this one your, ano pa rin, cravat pa rin. Open arm. Open palm and your closed palm. Straight elbow or knee, and bended elbow or knee. Still cravat. So, we were going to perform those bandaging techniques on as a return demo. First, we're going to demonstrate it to you. Then after that, it will be your turn to demonstrate that to us. Okay, so care of eye injuries. We're going to proceed with the specific injuries. One, we have your blows to the eye. So, gihampak si eye. Apply an ice pack immediately for about 15 to 15 minutes to reduce pain and swelling. Do not exert pressure on the eye. So, dapat ice pack po ha pag sinuntok ka at naigoin mo mata. Seek medical attention immediately in case of pain and reduce vision or discoloration, or we have that as a black eye. So, dapat pag may change of color na po, tapos masakit, and even reduced vision, you have to, anong gagawin natin? Seek medical attention. And chemical burn. Use your fingers to keep an eye open as wide as possible. So, and then you have to flush the eyes with water immediately. If possible, use warm water. If water is not available, use a non-irritating liquid. Okay, wala pong alcohol content ha kasi non-irritating. Hold the victim's head under a faucet or pour water into the eye from any clean container for at least 20 minutes. Continuously and gently. You cannot use too much water on these injuries, ha? So, little by little po. Next is irrigate from the nose side of the eye towards the outside. And then, to avoid flushing material into the other eye. Tell the victim to roll the eyeballs as much as possible to help wash out the eye. Kasi pag may foreign object, pag niroll mo yung eyeball, yung foreign object ay pupunta sa gilid. Then loosely bandage both eyes with cold, wet dressing and seek medical attention. Okay, next is your eye knockout. Nasuntukan. Cover the eye loosely with a sterile dressing that has been moistened with clean water. Do not try to push the eyeball back into the socket. So, natangtang ang mata ani. And protect the injured eye with a paper cup, cardboard folded into a cone, or a donut-shaped cravat bandage. So, cover the undamaged eye with a patch to stop movement of the damaged eye known as sympathetic movement. Seek medical attention. Kasi, pag na-injure yung left eye natin, automatically, di dapat natin ipamove kasi we're going to to apply what we call this one, do some management. Okay. So, if you're going to do management, dapat din yung right eye natin, yung walang injury, dapat i-close natin siya. Kasi pag open po siya, automatic pareho. Pag mag-move si right eye, si left eye mag-move din. Okay, do you agree? Next is foreign object. So flushing the object out by rinsing the eye gently with warm water. Hold the eyelid open and tell the victim to move the eye as it is rinsed. Okay, dapat para ma-wash out. And examine the lower lid by pulling it down gently. If you can see the object, remove it with a moistened gauze or clean cloth. Pag makita niyo po yung object. Pag hindi, many foreign bodies lodge under the upper lid, requiring some expertise in everything the lid and removing the object. Examine the upper lid by grasping the lashes of the upper lid, placing a matchstick or cotton tip swab across the upper lid and roll in the lid upward or over the stick or swab. If you can see the object, remove it with a moistened gauze or clean cloth. Okay, that's it. Ito, di ba, may object po yung mata niya. Okay, next slide, we have now your care for nose injuries or your nosebleeds. Keep the victim in a sitting up position to reduce blood pressure. Keep the victim head tilted slightly forward so blood can run out from the front of the nose. Not down the back of the throat. Bakit po? Which can cause choking, nausea, or vomiting. So, anong sabihin natin? Dapat tilted slightly forward lang po. Hindi po masyadong i-back. And then vomit could be inhaled into the lungs. Pinch or have the victim pinch all the soft parts of the nose together with between thumb and two fingers with steady pressure for 5 minutes. Compress the pinch parts against the bones of the face. Okay, that is the nosebleed na dapat i-pinch natin. If bleeding persists, have the victim gently blow the nose to remove any irregular clots and excess blood and to minimize sneezing. This allows new clots to form. This allows new clots to form. Then pinch the nostril again for 5 minutes. Apply an ice pack over the nose and cheeks to help control bleeding, especially if caused by a blow to the nose. Place an unconscious victim on his or her side to prevent inhaling of the blood and try the procedures listed above. Okay, back tayo sa keep the victim sitting up, pinch the nose. If bleeding persists, gently blow the nose, apply the ice pack over the nose, place an unconscious victim on his or her side to prevent inhaling the blood. Okay, those are all. Seek medical attention if any of the following applies. The nostrils pinching and other methods do not stop the bleeding. Okay, pag finish natin yung nostril, hindi nag-stop ng bleeding, so you have to seek for medical attention. And then you suspect a posterior nosebleed. Okay, nag-nosebleed pa rin baka sa back of the head, sa back ng nose nyo po, o meaning nag-internal bleeding na siya. The victim has high blood pressure, taking anticoagulants or your blood thinners or large doses of aspirin. Okay, kasi it will going to aggravate bleeding. Ito nga mga drug. Bleeding happens after a blow to the nose and you suspect a broken nose. Okay, next is your care of dental injuries. You have care for dental injuries or knockout tooth. Natangtang ang imong ngipon. So, have the victim rinse his or her mouth and put rolled gauze pad in the socket to control bleeding. Dali naman kayo siya sa tanan. So, find the tooth and handle it with it by the crown, so sa ulo po yun, sa ulo ng ipin, never the root, to minimize damage to the ligament fibers. The best place for a knockout tooth is in the socket, is its socket. A tooth often can be successfully reimplanted if it has been put back into the socket within 30 minutes after the injury. Okay, babalik pag hindi po niyo ginalaw yung ipin, tapos balik sa kanyang kinalalagyan o sinabi nating socket, is ano po, babalik po, hindi, ma-harden din po yun, hindi matanggal. So when immediately reinsertion is not possible, one of the worst thing you can do, a knockout tooth, is to transport it dry. Consider using a saliva for a short term, or if it is less than an hour. And some experts recommend that the tooth be placed in the victim's mouth to keep it moist until dental treatment is available. The method through the convenient this method through convenient presents the risk, especially in children, of the tooth being accidentally swallowed. Okay, so dapat hindi po siya applicable sa bata. And take the victim and the tooth to the dentist immediately. Anyways, dito sa Pilipinas, pag natanggal yung ipin, matanggal na agad, di ba? Hindi na siya binabalik. So we have care of impaled object is an object that is embedded in an open wound. Okay, so it should never be removed in the field unless it is through the patient's cheek or in interference with airway management or CPR. So do not remove or move an impaled object. Movement of any kind could produce additional bleeding and tissue damage. Expose the area, remove or cut away any clothing surrounding the injury. If clothes cover the object, leave them in place. Removing them could cause an object to move. Control any bleeding with direct pressure. Straddle the object with a gauze. And do not press directly on the object or along the wound next to the cutting edge, especially if the object has sharp edges. Okay. Then stabilize the object. Secure a bulky dressing or clean cloth around the object para ma-stabilize po siya. Some experts suggest securing 75% of the object with bulky dressing or cloths to reduce motion. Shorten the object only if necessary. If in most cases, do not shorten the object by cutting or breaking it. There are times, however, when cutting or off or shortening the object allows for easier transport. Be sure to stabilize the object before shortening it. Remember that the victim will feel any vibrations from the object being cut and the injury could be worsened. So, pag yung mga part po na medyo malapit na pong, for example, nagbitay na ba? So, care for amputations. Actually, these are self-explanatory. You don't just remember how to control bleeding, and that's it. So, do you have your amputated body parts left uncooled for more than 6 hours? So, sa Amerika kasi pag natanggal, na-amputate yung part nyo po, pwede ibabalik, di ba? Isa sa sinabi natin kanina, i-wrap with clean cloth, then soak it with cold water. Or, dapat yung water is malamig po siya. So, for 18, little chance. So, ano sabi? So, amputated body parts left uncooled. So, hindi po natin nilagyan ng malamig na tubig or ice. For 6 hours, have little chance of survival. 18 hours is a probability the maximum time allowable for a part that has been cooled properly. Muscles without blood loss, viability with 4 to 6 hours. Diba? Pwede mabalik. So what will you do? You control the bleeding with the direct pressure and elevated extremity. Apply dry dressing or bulky cloths. Be sure to protect yourself against disease. Tourniquets are rarely needed and if used, will destroy the tissue. Blood vessels and nerves necessary for replantation. So treat the victim for shock. So these are the common management or the regular management. recover the amputated part, and whenever possible, take it with the victim. However, in multi-casualty, marami po sila natanggalan ng mga body part. In reduced lightnings conditions or when untrained people transport the victim, someone may be requested to locate and take the severed body part to the hospital after the victim's departure. Pwede rin magkasama sila i-depart mo sa hospital, yung kamay niya na natatanggal at siya as a person, and pwede rin maulahi itong kamot. Dili pa pwede siguro nga mauna siya. Siyempre, kasi nagkamot. Ito na ulahi ang tagiya. Diba? To care for the amputated body part, if possible, rinse it with clean water to remove any debris. Do not scrub. Diba? Dili pwede scrub. The amputated portion does not need to be cleaned. Wrap the amputated part with a dry gauze or clean cloth. Put the wrapped amputated part in a plastic bag or other waterproof container. Pareho lang naman yung management. Place the bag or container with the wrapped part on a bed of ice. Bed of ice, ha? Hindi lang bed of roses na yun. Pag may amputated body part na, bed of ice na. Seek medical attention after. Okay, so we have there care for sucking chest wound. Oh, chest wound na tayo. So, as you can see, pare-pareho lang naman yung management, pero pag may problema sa paghinga, doon na po tayo mag-additional management na po. Diba? May additional management na siya pag may ano na. So, one is your open chest injuries pose an additional problem because they upset the delicate balance of pressure between the inside and outside of the chest. A sucking chest wound results when a chest wound allows air to pass into and out of the chest with each breath. Okay, may wound po yung natin chest dito. Have the victim take a breath and let it out. Then seal the wound with anything available to stop air from entering the chest cavity. So, dapat i-cover natin siya. Plastic wrap or plastic bag works well. Tape it in place within one corner and tape that creates a flutter valve to prevent air from being trapped in the chest cavity. If plastic wraps is not available, you can use your hand. So, i-cover lang po natin yung area na may wound. If the victim has trouble breathing or seems to be getting worse, remove the plastic cover or your hand to let air escape, then reapply. Okay. Seek medical attention. Ito po yung mga, for example, pag, di ba, pag naputas po yung chest, dapat dating there will be entrance of air. So, dapat tanggalin yung air. So, ito po yung nilalagyan ng tube sa hospital. Kasi may ano siya. Care for abdominal injuries or protruding organs. Or tawag na to na siya nga eviscerations. This occurs when internal organs protrude from an open wound. This is most commonly occurring with abdominal wounds. How would you do that? Manage? So, cover protruding organs with a dressing or clean cloth. Pour drinkable water on the dressing to keep the organ from drying out. Dapat you have to keep them wet. Seek medical attention. O dapat wet. Now, we will proceed with your burns. Okay, burns na po tayo. So, burns is an injury involving the skin, including muscles, bones, nerves, and blood vessels. This results from the heat, chemical, electricity, or solar or other forms of radiation. Common causes, we have carelessness with match and cigarette smoking, scalds from hot liquids, napaslot ka, defective heating device, cooking or electrical equipment, nabuthan ka, immersion in overheated bath water. So, example, kay ignorante ka, ang hot water bath, imunggi, paandar ang hot shower, wala nang mag-control ang temperature daan, so paslot ang labas. Use of such chemicals such as lye, strong acids, and strong detergents. Even kanabit ang mga Zonrox, diba? If you were going to place some Zonrox in the CR, and then you're going to keep it, if you're going to closed it, and while you are inside, then you will suffer from your, of course, aside from other injuries, you're going to burn your, excuse me, lungs even. So factors that determine the seriousness of the burn. We have the depth, the depth, superficial thickness or first degree, partial thickness or second degree, or your full thickness or the third degree burn. So, excuse me. So we have the depth. The deeper the burn, the more severe it is. Making an assessment of burn depth will help you decide whether to seek medical care for the victim or not. Generally, three depth classifications are used. One is superficial or first degree burn, just like for example, sunburn. Okay. Involves only the top layer of the skin, the epidermis, ang nasunog. The skin turns red and but does not blister or actually burn through. The burn site is painful. A sunburn is a good example of the superficial burn. For example, put ka ng using of your skin perfections. Ano pa yung iba? Yung mga, ano ba yan? Mga um, maxi peel. Yun po. First degree burn po yun. Partial thickness. Second degree burns involves an epidermis and some portion of the dermis. These burns do not destroy the entire thickness of the skin, nor is the subcutaneous tissue injured. Typically, the skin is moist, mottled, and white to red. Blisters are common. Partial thickness burns cause intense pain. Bakit po? It affects now the dermis. Then wherein there is your pain sensation scattered over. And then the full thickness of the third burns extend through all the skin layers and may involve subcutaneous layers, muscle, bones, or internal organs. The burned area is dry and lethargy and may appear white, dark brown, or even charred. Okay. So, some full thickness burns feel hard to touch. So, they may hiccup. Clotted blood vessels or subcutaneous tissues may be visible under the burned skin. If the nerve endings have been destroyed, a severe burned area may have no feelings, walay sensation. However, the surroundings less severely burned areas may be extremely painful. Perting sakita yan. Yan. So, superficial, so the skin lang po. Ito lang po yung affected. Pag partial thickness, yan, may blister na. Pag full thickness, manangitim na po siya. Tapos, yung skin natin naan ganito. Na tuklap. Ay, parang nalalumba. 30. Here we have the rule of 9. So, 9 na po ang ato. Head and neck, we have 9% ang nasunog. Then portion of posterior trunk, 18%. Anterior trunk, 18%. Each upper extremity, 1 and then 2, tag 9%. Each genitals, 1%. Then each lower extremity, we have 18%. O, dyan sa adult. Pag bata, ito yung division. Rule of 9 still. Ang paa, tsaka paa, 14, 14. And then ito, tsaka likod, 18. And then the arm, 9, 9. 18 yung face. Pero sa adult, yung face natin is 9% lang po. So, the extent of to the affected body surface. So, we have there your one of the factor had the depth ang first, and now the extent to the extent of the body surface area. This means estimating how much the body surface area the burn covers. A rough guide as the rule of 9 assigns a percentage value to each part of an adult body. The rule of 9 must be modified to take into account the different proportions of all small child and infant. For small or scattered burns, use the rule of Palm. O kung maliit lang po, rule of Palm. Pag malaki na, body part, rule of 9. The victim's hand, excluding the fingers and the thumb, represents from about 1% of his or her total body surface. For very large burn, estimate the unburned area in number of the hands and subtract from 100%. Okay, ano sabi? Pag malaki po yung burn, estimate the unburned area. Okay. So, rule of 9 yung ano to. For example, yung dalawang kamay lang ang hindi na burn. So, 18, 9%, 9%. So, 18. 100 minus 100 minus 18%, that would be, magkano ba? 82% to the burn na area ng patient. Okay. Tapos, for example, yung 9, dalawang kamay, tapos yung face, 9. So, 18 plus 9, that would be, magkano ba yun? 18 plus 9. So, that would be 36, di ba? So, 36 minus 1, 100 minus 36. So, ang hindi na burn natin is only 64%. Okay, location of burns. Burns on face, hand, feet, and genitals are more severe than on the other body parts. Or circumferential burn, one that goes around the finger, toes, and arm, leg, neck, and chest, ang tawag circumferential burn, is considered more severe than a non-circumferential burn. One, because of the possible constriction and tourniquet effects on circulation and in some cases breathing. All these burns require medical care. So first the depth, the extent of affected body surface area, and then the location of the burn, and the last one is the victim's age and medical condition. So determine if other injuries or pre-existing medical problems exist, or if the victim is elderly, over 55, or very young, under elderly, under 5 years old. A medical problem or belonging to one of those age group increase a burn severity. In general, people under age 5 and over age 55 have thinner skin and often burn more severely. People with chronic medical problems also tend to have more severe burns, especially if they are not well nourished, have heart or kidney problems, or area exposed to the burn surface for a prolonged period because they are unable to escape. So these are the things that you have to consider. Follow-up with it will enable the first aider to determine the severity of the burn. 1. Critical burns. Okay, these are full thickness burns involving the hands, feet, face, upper airway, or genitalia. And then next we have also your ano ba? We have also your, what we call this one, full thickness burn covering more than 10% of the body's total surface area. So, ano po yan? Full thickness burns. Okay, yung third-degree burns. Partial thickness burns covering more than 30% of the body's total area. Then we have burns associated with respiratory injury or smoke inhalation, burns complicated by fractures, burns in patients younger than age 5 and older than 55 years that would be classified as moderate or young on young adults. Moderate burns. So we have full thickness burns including 2% to 10% of the body's total surface area, excluding the hands, feet, face, genital, or upper airway. Partial thickness burns covering 15 to 30% of the body's total surface area. Superficial burns covering more than 50% of the body surface area. And then minor burns, we have full thickness. Burns covering less than 2% of the body's total surface area. Partial thickness burns covering from less than 15% of the body's total surface area. And superficial, parehong 50% of the body surface area. So, pareho sa moderate burn yung minor burn natin. Okay, type of burn injuries. 1 is your thermal burns. So, thermal burns, okay, not all burns are caused by flames. Contacts with hot objects, flammable vapors, and that ignites and causes the flashes of or explosion, and steam or hot liquid are other common cause of your burn. So, care of thermal burns, we have relieve pain by immersing the burned area in cold water or by applying cold cloth. Apply cold until the part is pain-free, both in and out of the water, usually 10 minutes, but in many takes 45 minutes. Okay, 45 minutes. Cold also stops the burn progression into deeper tissue. If cold water isn't available, use any cold liquid drink to reduce the burn skin temperature. Okay. And next we have your cover the burn with a dry, no sticking, sterile dressing or a clean cloth. Covering the burn reduces the amount of pain by keeping air from the exposed nerve endings. The main purpose of the dressing over a burn is to keep the burn clean, prevent evaporative loss, and reduce the pain. Okay. Care for third-degree burns. We have it usually is not necessary to apply cold or third-degree burns. Bakit? Since pain is absent. Pag third degree po, wala nang pain. Second degree lang po, tsaka first degree ang meron. Any pain felt with the third-degree burns comes from the accompanying first and second-degree burns, for which cold application can be helpful. But sa area na may third degree, wala na po. Just cover the burn with a dry, non-sticking sterile dressing or a clean cloth. Treat the victim for shock by elevating the legs and keeping the victim warm with a clean sheet or blanket. Care for scalp burns. Cover the scalp burns with a cool, moist, sterile dressing and transport the patient to the hospital. Do not apply ointment, grease, or butter to the scalded area. Okay. Then chemical burn. A wide range of chemical agents is capable of causing tissue damage and death on contacts with the skin. So, as with thermal burns, the amount of tissue damage depends on the duration of the contact, the skin thickness in the area of exposure, and the strength of the chemical agent. Chemicals will continue to cause tissue destructions until the chemical agent is removed. The three types of chemical acids, we have alkaline organic compounds, are responsible for most chemical burn. Chemical acids. Okay. Care of chemical burns. You just read this one. Immediately remove the chemical by flushing with water. So, pareho lang po yun. Flush lang with water, ha? So, if available, use the hose or shower. Brush dry powder chemicals from the skin before flushing. So, unless a large amount of water or immediately available, water may activate a dry chemical and cause more damage to the skin. Take precautions to protect yourself from exposure to the chemicals. Remove the victim contaminated clothing while flushing the water. Clothing Clothing can hold chemicals, allowing them to continue to burn as long as they are in contact with the skin. Flush for 20 minutes or longer. Let the victim wash with mild soap before the final rinse. Dilution with large amounts of water decreases the chemical concentration and washes it away. Okay, then cover the burned area with a dry dressing or for large areas, clean pillowcase. If the chemical is in the eye, flood it for at least 20 minutes using low pressure. Seek medical attention immediately for chemical burns. Now is your electrical burns. Electrical burns na po tayo. So the injury severity from exposure. So, we have exposure to electrical current depends on the type of current, direct or altering, the voltage, the area of the body exposed to the duration of the contact. Okay, that's it. So, next is we have types of electrical burns, contact burns, flash burns, and arcing injuries. When the current is most intense at the entrance and exit sites. Flash burns when extremity is close to an electrical flash or it's struck by a flash of lightning. So that's your flash burns. Arcing injuries when a current jumps from one surface to another. So care for electrical burns. Make sure an area is safe. Unplug, disconnect, or turn off the power. If that is impossible, call the power company or ask for help. Check for the ABCs, airway, breathing, and circulation. Provide RB or CPR, rescue breathing, or CPR if necessary. If the victim check for the spine injury. Treat the victim for shock by elevating the legs 8 to 12 inches and prevent heat loss by covering the victim with a coat or blanket. And seek medical attention immediately. Electrical injuries are treated in burn center. Okay, so we have here the rules for down power lines. I won't include this one. You just read. Ha? Read lang nito. Now, we're going to proceed with your poison. So, is there any substance, solid, liquid, or gas that tends to impair health? So, di ba, or cause death when introduced into the body or onto the skin surface. A poisoning emergency can be life-threatening. Causes we have common is suicide attempts and occasional accidental poisoning. Ay, hindi natin sinasadya. Or in case of bata, pag example, yung gas or gasoline nilagyan mo sa mesa, tapos ng bata, yung lalagyan mo sa tubig is tanduay or something. Tapos nandun yung bata, ininom niya po. So that's your accidental poisoning. Accidental burn pa din. Ways in which poisons may occur: with ingestion by mouth, inhalation by breathing, injection by animal bites, stings, and syringes, absorption by skin contact. So common household poisons: sleeping pills, pain relievers, antiseptic solutions, insects and rodent poisons, kerosene, denatured alcohol, lye and acid including boric acid, poisonous plants, contaminated water, plus your fuel. Signs and symptoms: so you have headache, irritability, chills, increased salivation, pain on swallowing, dizziness, weakness, drowsiness, pain, skin, fever, depression, loss of appetite, nausea, abdominal pain, diarrhea, vomiting, and all. So you just read what are the signs and symptoms of your brain. Of your poisoning. Some preventive measures of poisoning: keep all drugs and harmful chemicals locked up away from the reach of children. So basic things to do naman eh. Never take the medicine in the dark. Of course, dapat na in light. When taking the medicine, read the label 3 times before, during, and after taking the medicine. Dispose promptly with incorrect prescription pad and expired medicine. Do not consume canned goods which have rusty tins and bulging tops and bottom. Transfer immediately liquid contents from the cans after opening. Do not consume food which are foul odor, usually cooked, and then, asa na to? Foul odor, unusual color, and then your molds. Hindi cook pala. Refrigerate foods which contain cream, milk, mayonnaise, and other mixtures which easily change flavor when left unrefrigerated. Educate older children regarding the dangers of poisoning and your drugs. Okay. Okay, so we were going to proceed with the next slide. So first aid, check the victim's ABC. So we have check the victim's eyes and skin for chemical burns if there are any flaw. And then flush the affected area thoroughly with cold and water for 15 minutes. So if the victim's having seizure, protect his or her from injury and give corresponding first aid for seizure. So dapat, pag nag-seizure po siya, so natumba siya, dapat yung head lagyan natin ng medyo soft. And then, of course, you have to let the patients, keep the patient ventilated. If the victim throws up nagsuka, protect the airway. Get medical help. Instances when vomiting should be induced. If unresponsive, yes, dapat. Kung unresponsive ang patient, dapat ato siyang i-induce vomiting. Cannot maintain an airway. Has ingested an acid or corrosive such as lye or petroleum products such as your gasoline or furniture polish. Has a medical condition that could be complicated by vomiting such as heart attack, seizures, and pregnancy. Ingestions of ingested poisons is one of the that is introduced into the digestive tract by way of the mouth. One form of ingestion of poisoning is food poisoning, a general form that covers a variety of conditions. You have to suspect food poisoning if the victim ate food that didn't taste right. Of course, you have to suspect food poisoning. Several people who are together become ill sa fiesta, di ba? So that's your food poisoning. Botulism is a form of food poisoning that can cause paralysis and death if it is not treated. Botulism toxins are most often found in home canned vegetables, honey, smoked meats, or fish. Signs and symptoms developed up to 36 hours, including headache, dizziness, slurred speech, difficulty in swallowing, and difficulty of breathing. Okay, general reminders. Identify the poison. Dapat dili na mailabay ang tatlong sulalan sa poison because you're going to identify the poison. Kay laylay sila og management. Pareho lang kamay, pero na siya distinct management. You have call local poison control center or nurse physician or advice. Do not wait for signs and symptoms to develop if you suspect poisoning emergency. Do not use an universal antidote. Yes. Do not neutralize the poison with vinegar, lemon juice, or any substance unless you are told to do so by poison to control poison control. That's the position. The poison control center or the physician. Do not induce vomiting unless you are told to do so by poison control center. Do not give an unconscious victim anything by mouth. Do not rely solely on products label information, which may be incorrect. So we have first aid, check the victim's ABC. The victim is having seizure, so we are going to have the summary. Protect the head from injury. If the victim throws up, protect the airway. So we have there your calm and reassure the victim and keep his or her comfortable. Okay. Inhale poisons. A poison breathed into the lungs. So signs, we have to read this ha. History of inhaling poisons, breathing difficulty. Siyempre, naka-inhale siya. Di ba sa sunrox na yung ma-inhale or your muriatic acid? So you're poisoning yourself. Cough, hoarseness of voice, burning sensation in the throat, cyanosis, bluish discoloration of the skin and mucous membrane. We have dizziness, headache, seizure, unresponsive, advanced the stage. Carbon monoxide poisoning. Kung nasasakyan bitaw, nga sa sasakyan na neon, example, gion ni mong aircon, tapos natulog ka sa loob while nag-wait sa barge, na you are at risk of carbon monoxide poisoning. The gas is invisible, tasteless, odorless, and non-irritating. The incomplete burning of organic materials such as gasoline, wood, paper, charcoal, coal, and natural gas produced it. Since the signs and symptoms, the eye, headache, ringing of the ears, or tinnitus, chest pain or angina, muscle weakness, nausea and vomiting, dizziness with visual changes, unconsciousness, and respiratory or cardiac arrest. Okay. First aid. Okay, rescue the victims from the smoke or gas or fume. Call the poison center for advice. If you don't have the poison center, seek medical help. Do not wait for signs and symptoms to develop if you suspect inhalation of your poison. Poisoning occurred. Inhalation poison. Then do not give unconscious victim anything by mouth and do not rely on products labeled which may be incorrect. How to rescue breathing victim of possible inhaling poisoning. Call for help. Check to see if protective breathing gear is available. If possible, open windows and door to help disperse fumes. Do not light a match, flip a switch, or produce any flame spark. Take several deep breaths or fresh air. Stay below smoke or fumes. They are visible in the room. If possible, quickly shut off any open source of fumes. Do not start any first aid until you and victim are in the fresh air. Use the body collar or cloth rag to remove the victim from the area. Next is absorb poisons. Okay, a poison that enters the body through the skin. So you just read this one anyway. Pareho lang naman siya sa skin injury or your burn. Injection of poisons, a poison that enters the body through a bite, sting, or the mosquito. We have insect bites. So these are your stinger, maybe present, pain, swelling, possible allergic reaction. First aid, remove the stinger. So tanggalon niyo mo siya. Scrape it away or use tweezers. And then we have wash wound, cover the wound, apply cold compact, wash and signal of the of allergic reaction. So spider bites, scorpion sting. So here, signs of symptoms. One, bite marks, swelling, pain, nausea, and vomiting, difficulty breathing. Well, first aid, wash wound, apply a cold pack, get medical care for receive anti-venin, call emergency hotline. So marine life sting. So dami na, no? So we will not, ano na lang this one. Example, jellyfish, you have to soak your hand with your vinegar solution. Snake bite, signs and symptoms. Ito po yung ano. Okay, so balik lang man siya. Check for ABC. You just read this one, ha? Human and animal bite. Okay, bite mark, bleeding ang area. First aid, if bleeding is minor, wash with wound. Control bleeding, apply antibiotic ointment. We have covered the wound, get medical treatment if wound is if wound bleeds severely or if you suspect animal or rabies bite. Call local emergency hot number. Skin contact poisoning. So skin contact poisoning na po. So you read poisoning plant or the chemicals. Diba? Anong with Dieffenbach? Yeah. Poisonous plant mo na siya. Signs and symptoms. Skin irritation, rashes, redness, fever, itchiness, tachycardia, swelling, intense burning sensation, evidence of the poison, and then headache, hypertension, and respiratory stress. Okay, just read this one ha. Kay balik-balik na siya. Ano, repeat. There is repetition of management. So we have drug and alcohol emergencies. Okay. Okay, so we're going to continue drug and alcohol emergencies. We have your drug abuse, diba? So actually, I have a tawag kanang that is why before when I took up when I am already a full-fledged nurse, because I already know the medications and the medicines and all, especially pain relievers, I tend to avoid those. Bakit? I don't want to abuse the drug because I know if I do abuse the drug, and tendency my kidney would also suffer. So that is why if in case I am in pain, if even only if I can manage it without taking any medications, I won't do so. Bakit? Kailangan kasi nating i-condition yung self natin na hindi tayo maging dependent sa drug. Not as in your prohibited drugs, but the drugs of your, ano din, yung mga drugs, prescribed drugs. So, kailangan i-limit. So, when you're in pain, so you just drink few glasses of water, because possibly you are, especially headache. So, you eat, drink plenty of water, because possibly you may be just suffering from dehydration. Okay, dehydrated ka lang, kaya yung sumakit yung ulo. So, drug abuse is the self-administration of one or more drugs in any way that is not in accord with approved medical or social practice. So, signs and symptoms, this is life-threatening. If in case of emergency, kung the patient will be unresponsive, and the patient also suffers, or the person suffers from any breathing difficulties. Again, if the patient is unresponsive, and of course, there is breathing difficulty, sorry for the interruptions, or inability to maintain an open airway. Okay, so hindi po siya maka-open ng mouth niya po, or example, there will be difficulty of breathing already, na Baka hindi siya maka-open ng mouth. Possibly, maka-open siya, but there is an obstruction. That's it. Hindi siya pwedeng mabigyan ng, ano, um, it would be a hard time for us to give emergency care. Abnormal or irregular pulse, fever, vomiting with an altered mental status, or without gag reflex. Plus, kung may seizure siya. Ito po yung mga life-threatening emergencies. Okay, seizure. So, kung saan kayo papatol. High priority for transport kung na ay altered mental status, extremely low or high blood pressure, either low po yung BP niya or mataas yung BP niya. Sweating or tremors, or even if the patient is already hallucinating because of alcohol withdrawals, and digestive problems including abdominal pain or your bleeding, and visual disturbances, slurred speech, and uncoordinated muscle movement, disinterested behavior, loss of memory, combativeness, or musukol na siya, or mahilabot na, aggressive na patient, and paranoia. Or paranoia, she's thinking that something is doing harm, that you're going to do harm to her. So you would suggest the person to be transported immediately and be handled with caution. Then we have first aid, establish and maintain an open airway, monitor the patient's mental status and vital signs frequently, maintain the patient's body temperature, take measures to prevent shock, care of any behavioral problems, and support the patient. So what do you mean by support the patient? Do not condemn the patient. Do not condemn. Hindi po natin isabihin kasi nag-drug addict ka, kasi nag-gamit ka ng ganyan, prohibited drugs and all, kasi hindi ka nag-listen, something like that. Because especially, you have to respect the patient also. And of course, treat the patient as a patient, not as a person who just committed or who committed a huge mistake. Next is your alcohol. So alcohol is a powerful central nervous system depressant. Okay. Kaya nga, yung iba, pag nag-alcohol, iiyak, di ba? Tapos yung iba naman, pag nag-alcohol, take ng mga naglasing, ay magiging magsa-self-pity, feeling nila sila very down and all because it is very much a depressant. It is both sedatives, as the substance that decrease activity and excitement, and hypnotic, meaning that it induces sleep. Okay, pag alcohol. Sedative siya kasi nga masisidate ka. Maluya ka ba? O, di ba? And in general, alcohol dulls the sense of awareness, slows reflexes, and reduces reaction to time. Kaya nga yung iba nare-rape na pag nag-take ng alcohol. Kasi nga, wala sila umuwi ba? Okay, so as what I've said, it induces sleep. Plus, of course, it will going to decrease activity and excitement. So, wala po. So, they will just allow everything that flows. So, it may also cause aggressive and inappropriate behavior and lack of coordination. So, manlabay, pero di makaigo, something like that. Musukol, pero dili makasukol. Okay. Signs of intoxication, we have odors of alcohol on the breath. Then, swaying and unsteadiness. So, magparay-paray. Slurred speech, patakalagyawit or magdubalik-balik. And nausea and vomiting. Vomit yun ang mag-alcohol. Okay. Flush face, drowsiness, violent, destructive, and erratic behavior. So, we have self-injury, usually without realizing it effects, di ba? Ay manumbag siyang kaugalingon, mag-self-blame, sumbago niyang pa, sumbago niyang iyang tiil or kamot. So, ang ending, ay pa makakuan pag nahumana. Pag nahuwasan na. Alcohol is a depressant. It affects judgment, vision, reaction to time, and coordination. So, that's why, pag ingani, ang pwede kung babae, posible ma-rape. When taken with other depressants, the result can be greater than the combined effects of the two drugs. In very large quantities, alcohol can paralyze the respiratory center of the brain and cause death. So you have to limit alcohol. Labi na to mag 1,002, 1,003 sa botilya sa Red Horse. So, limit alcohol. Okay. First aid. Give the same attention as you would to a patient with an illness or injury. Monitor the patient's vital signs constantly. Provide life support if necessary. Position the patient to avoid aspiration or vomit. So, position, dapat naka-forward position siya or naka-sideline. Hindi po siya naging supine position kasi pag mag-vomit siya, ang tendency pupunta sa lungs. So that would be aspiration. Protect the patient from hurting him or herself. So next is your overdose. It's an emergency that involves poisoning by drugs or alcohol. Withdrawal refers to the effect of the body that occurs after a period of abstinence from the drugs or alcohol to which the body has become accustomed. You have to take note that do not immediately decide that the patient with apparent alcohol on the breath is drunk. The sign may indicate of an illness or injury such as epilepsy, diabetes, or heavy head injury. Pag naay alcohol breath ha, dili po tanan ang anay alcoholic breath is drunk. Kung dili pwede siya because of the effect of the medicine of diabetes, and of course your epilepsy and head injury. Okay. We will now proceed to bones, joints, and muscles injury. So musculoskeletal system consists of bones, kasi musculo is muscle. Skeletal means bones. Then together they have also the joints. Okay. And gives the body framework and allow movement. Muscles connect to each other, that is your joints. Synovium synovial fluid, it lubricates the joints, while your bone helps support the body protect from internal organs. While your ligaments expand and contract in order for the muscle to move, that is your ligament. Common causes of problems with this, we have vehicular accident, motorbike accident, mishandling of tools and equipment, falls, and then your sports. So that is your problems, cause of your problems with your musculoskeletal system. Signs and symptoms, we have your pain, bruising, swelling, misshapen appearance and obvious deformity, exposed bones, case of your fracture, pale bluish skin, loss of pulse in an injured limb, and your numbness further down to the arm and your leg. So injuries involves bone, joints, and muscles. So we have muscle cramps or your spasm is a sudden painful tightening of the muscles. So first aid, have the victim stretch out the affected muscle to counteract the cramp. So massage the cramped muscle firmly but gently. Apply heat application. Use a heating pad or hot water bottle wrapped in cloth. Moist heat is more effective than of dry heat. Do not apply direct heat to the skin. And get medical help if cramps persist. Especially yung cramps is common siya among pregnancy and of course athletes. Pregnant women din. Muscle strains are pulled muscles. Okay, another term for muscle strain is your pulled muscle. Is the sudden painful tearing of muscle fiber during exertion. Signs and symptoms include pain, swelling, bruising, and loss of efficient movement. So first aid. Pag muscle strain, apply cold compress at once. So reapply them for 20 minutes every 3 to 4 hours for a period of 24 hours. Do not apply directly to the skin, meaning gamitin natin ng moist heat. Okay, may hot water bottle. Di pwede na hot compress, pwede rin. No, not hot compress. Hot compress nga, pero hindi yung pag sinabi natin do not apply it directly to the skin, especially your eyes, di pwedeng diretso sa, sa skin. Kailangan may barrier siya na cloth. Example, your hot packs may hot pack, tapos may cloth, tapos tsaka na yung skin. Kasi you are prone to have, what we call this one, burn. Pagkapon siya. Dili heat, but cold. That is, isa ng condition, we have your frostbites. If the strained muscle is in arm or leg, elevate the limb to reduce swelling and bleeding within the muscle. Rest and pulled muscle for 24 hours. Get medical help if the victim is in great pain or if the body part is not working properly. Okay. Well, now we will have your sprain. Occurs when the joint loosens. This is caused by a torn fibers in the ligament. Sprains are painful and can cause swelling and bruising, but the joint may still function and usually does not appear misshapen unless all the fibers or ligaments are torn. So some reminders: if the victim is severely injured of you suspect a broken bone, get medical help. If the injured area is misshapen, victim is in great pain, a body part not working properly, or if there is signs of circulation beyond the injured area has been impaired, seek medical help. In general, you have to seek medical help if you have sprain. Do not give the victim anything by mouth if you suspect severity of injury. Do not ignore persistent joint pain. A body part that hurts should not be used. Okay. So first, hindi pwedeng gamitin yung masakit na part. First aid, remove any clothing or jewelry from around the joint. Apply cold compress at once. Reapply them as often as possible, at least 20 minutes 3 to 4 hours a day for the period of 24 hours. Do not apply ice directly again to the skin. Elevate the affected joint with pillow or clothing. Do not move the injured part at least 24 hours. The victim's physician may recommend on over-the-counter anti-inflammatory medication such as your aspirin or ibuprofen, which is appropriate for the victim's general health. So, pwede rin mag-inom siya. Dislocation of broken bones. So joint dislocation can happen when bones come out of a ligament. Signs and symptoms include pain, misshapen appearance, swelling, and loss of functions. Broken bones, such as your split or snap fractures, can be closed. The skin is not broken or open, or one of the bone ends pierce the skin o nitusok sa skin. Signs and symptoms can include pain, swelling, misshapen, or even very painful, and it's a myth that you cannot use a broken bone. If you have any suspicions that the bone is broken, assume that it is. Okay, general information: if a joint is overstressed, the bone that meet at the joint may get disconnected or dislocated. When this happens, there is usually a torn joint capsule and a torn ligaments and often nerve injuries. If more pressure is put on the bone that it can stand, it will fracture or split or break. Open fractures in which bones pierce the skin can easily become infected. If the infant or toddler does not start to use an injured arm or leg within hours of an accident, or he or she continues to cry when the injury area is touched, assume the child has broken bone. Get medical help. It is hard to tell the dislocated bone from a broken bone. Both are emergencies. The general first aid steps are the same for both. Okay. So some reminders. If you suspect that the victim has dislocation or broken bone and there is severe bleeding, call emergency hotline or assistance. Okay, if you cannot completely immobilize the injured area, so we have call emergency medical assistance gapon. Do not move the victim unless the injured area is totally immobilized. Okay. Totally immobilized po, hindi pwede ating ano. And then next, we have your, so we have now your, do not move a victim with an injured hip, pelvis, or upper leg unless it is absolutely necessary. If you must move them, the victim immediately use the clothes drag technique. Do not attempt to straighten a misshapen bone or joint or to change its position. Do not test misshapen bone or joint for loss of functions. Do not give the victim anything by mouth. Okay. So we have first aid. Check the victim's ABC. Open the airway. Check the breath and circulation if necessary. Begin rescue breathing or CPR. Diba? We have this one. We have already know this one. And keep the victim still. If the skin is pierced above broken bone, or if the suspect that may be a broken bone beneath an open wound, take steps to prevent infection. Do not breathe on the wound and do not wash or probe it. Cover it with sterile dressing before immobilizing the injury. Splint and sling. The injury in the position when which you found it. It is important to immobilize the area both above and below the injured joint and to check the circulation of the affected area after immobilization. Take steps to prevent shock. Lay the victim flat. Then we have if he or she feels 8 to 12 inches and cover the victim with a coat or blanket. Do not place the victim in the shock position if you suspect any head or neck or leg injury if the position causes the victim's discomfort. So seek medical help. How to split. Okay, how to split. So I'm going to show you how to split anyway. So no need um no need to be that concerned. Kahit tuduan man muna ako unsang pag-splint, ha? One thing you have to remember in splinting, it should not be too loose or too tight. Oh. Gaya naman, if splint is just to keep an injury body part from moving, it protects from further damage until you have seek medical help. There are many commercially made splints, but you probably will have to improvise it. Remember to check circulation and immobilizing the part. Follow these general guidelines. You just read the guidelines, ha? So that we would be um, that fast. Okay, here your collarbone. Use the bandages. Do you have in collarbone? Use sling, preferably underarm sling. Then another tie to bind the sling across the chest. Then rib. Support the injured part of the pillow. Padding before tying. Okay, so here are the samples of our splints. Elbow. You just read this one. Mm. Extrication spinal management. Okay, basic extrication and spinal injury management na ba tayo? You just read na lang the splinting, ha? Kasi, anyways, I'm going to demonstrate that to you tomorrow. Okay. Where will we? Saan na tayo? So, basic extrication na tayo. Okay. So, basic extrication, excuse me, spinal cord injury. So, one is, ano po? You are going to define extrication first. So, as you have seen, is a removal of the victim from difficult situation or position, or removal of a patient from a wrecked car or other place of entrapment. When to perform? Vehicular accident, train, derailment, hindi po yung train, hindi nag-follow sa rail, and then collapsed building, and then we have also emergency situations such as cave-in. So, cave-in sa ilalom, so kaonin mo siya. Excuse, fire, water accident, and other similar injuries. Classification of rescue operation, we have basic rescue, medium rescue, and heavy rescue. Pag basic, minimum equipment needed, example, motor vehicle accident, and a stable building. Pag medium, involves specialized equipment such as rigging, anod, or technical rescue. Heavy rescue, complicated rigging handling under extremely difficult or advanced condition. So we will not handle the medium and the heavy. We'll just try to be concerned of the basic rescue. Multiple casualty procedures. Lightly pinned victim, those who can be freed by light lifting a beam, are extricated and stabilized first. The trapped in more difficult physical circumstances still can be rescued by using an equipment at hand. A minimum amount of time are extricated. Victims required extended for a difficult extraction are removed from the entrapment next, while bodies of those who have died are extricated last. Okay, wala na may pulos, di ba? Patay naman to siya. During all phases of rescue and extrication operations, your primary responsibilities are to provide emergency care to the victim or patient and to prevent further injury to the victim or patient and others. Okay. Problems in rescue situations, we have there your several medical rescue units. Marami pong mag-rescue. So, maglibog na kung kisay unahon, kung kisay tuwan, o kisay dilituan. Lack of identifiable leaderships and daghang rescue vehicles pero walay mo command. Disorganized provision of care and principles of execution. So, although no two accident situations will be identical. The following basic principles of extrication apply to all rescue situations. First is evaluate, size up the situation, locate all the victims, provide safety and rescue for rescue persons and the patient. So dapat naka PPEs. We have PPEs and may personal protective equipment. Secure the scene. So dapat, di ba, butang nila o kanang yellow line, di ba? Or yellow hikot. And then gain access to the patient, provide emergency medical care to stabilize patient, disentangle the patient, prepare the patient for transfer, and then transfer the patient. Spinal injury management, common cause of spinal injury. We have automobile and motorcycle accident. Gunshot wounds, shallow water diving injuries, and of course, excuse me, we have your fall from the height, cave-ins, unconscious injured victims with sustained scalp laceration and contusion. Signs and symptoms, we have pain in the head, neck, or back, numbness, tingling sensation, pain when in motion, deformity, tenderness, laceration of contusion, paralysis, or anesthesia. No pain. Okay. Now, we will proceed with your environmental emergencies. The human body is equipped to withstand extreme temperature. Usually, its mechanism for regulating body temperatures work very well. However, when the body is overwhelmed by extremes of heat and cold, illness occurs. Normal body temperatures must be maintained within a very narrow range for the body's chemistry to work efficiently. If the body or any part of it is exposed to cold environments, this mechanism may be overwhelmed. Cold exposure may cause injury to the individual parts of the body, such as the feet, hands, ears, nose, and other parts. When the entire body temperature falls, the condition is called hypothermia. Okay, pag bumaba po yung temperature, it is called now your hypothermia. So your hypothermia could be managed as your unsa na siya? First aid, check responsibility the patient is alert or able. And then after that, we have there your allow him to drink water, warm liquids, never give a confused or lethargic patient anything to drink. Cover the patient with a warm blanket, apply hot compress. Check vital signs and refer to the physician. So anyway, ang classification niya, we have your mild, severe, and your mild, severe hypothermia. You just read na lang the signs and symptoms of the mild. Now, we'll proceed with your severe. So we have patients may become unresponsive. This is true medical emergencies that can lead to death. So we have extremely low breathing rate, extremely slow pulse rate, and responsiveness, fixed and dilated pupils, rigid extremities, absence of shivering. First aid, check responsiveness, check IABC, perform CPR if needed, and care for shock. And then, of course, refer to the physician. Okay, that's it. Now, we will proceed with your heat emergencies. So we have now your heat emergencies. Our body functions properly within only a limited internal temperature range. A victim of heat illness may start by experiencing muscle cramps or heat cramps. These are brought on by loss of salt from heavy perspiring. Okay, so if the victim does not cool off at this point, he or she may develop heat exhaustion because of dehydration. Being in a hot environment is only one factor that can lead to heat illness. There is also internal factors such as medications or alcohol intake before or after vigorous exercise may increase the risk of heat illness. Children and older people are more susceptible and they tend to go from feeling fine to sudden collapse. Even succumb to heat illness if he or she ignores warning signals. Okay. So, mechanisms of heat loss, we have convection. So, the body heat is lost to surrounding air, which becomes warms, rises, and is replaced with cool air. So, for example, yung imong lawas is init ka, tapos kanang init pa ng surrounding. So, definitely, oh no, init ka pero cold ang surroundings. So, ang temperature, ang imong temperature is mo adapt with the cold environment. So you will have heat loss there. Repeat respiration. This occurs when a person breathes in cold air and breathes out air that has warmth inside the body. So hindi po siya abnormality. Mechanism, one of the mechanism po siya heat loss. Radiation, body heat is lost to nearby objects without physically touching them. Okay. So transfer siya. For example, kanang ways of disinfecting, di ba? Bulad nimo ang mga undan nimo sa gawas, then pagkuha nimo init na sila. Conduction, body heat is lost to nearby objects through direct physical touch. Conduction. While evaporation, body heat causes perspiration, which is lost from the body surface when changed from liquid to vapor. Okay. Three general types of heat emergency. We have heat cramps. We have a muscular pain and spasm due largely to loss of salt from the body in sweating or to inadequate intake of your salt. So that is your heat cramps. Okay. So the cramps are more severe if the victim has drunk a large quantity of tap water or soft drinks without replacing the salt deficiency, in which case several severe mental confusion and even convulsion may develop. Heat cramps may be associated with heat exhaustion. Excuse. So, read na lang the signs and symptoms, muscle cramps, often in abdomen and leg, heavy perspiration, lightheadedness, and weak. So, management, have the victim rest in his feet, elevated 8 to 12 inches. Ihangin mo siya, mara siya o shock position. Cool the victim. They do not use alcohol rub. Give the victim electrolyte beverage to sip, for example, Gatorade or Pedialyte. Or make salted drinking by adding 1 teaspoon of salt to a quarter of water. Try to give a half cup every 15 minutes. If electrolyte beverage or salt are not immediately available, give the victim cool water. To relieve muscle cramps, massage the affected muscle gently but firmly until they are relaxed. Okay, that is your heat cramps. Heat exhaustion. Okay, a response to heat characterized by fatigue, weakness, and collapse due to inadequate intake of water to compensate for loss of fluids through sweating. Okay, grabe na, gipaningot na kay ka, nawala na yung heat. Okay. And then, of course, you have to read mo lang the kwan ha. Pareha raman siya. So, cool, pale, or red, moist skin. Even if the victim's internal temperature is rising, his or her skin may still be cool. Dilated pupils, headache, extremely thirst, nausea, vomiting, irrational behavior, weakness, and even your unconscious. Can become unconscious. So we have first aid. Have the victim rest until the feet elevated to 8 to 12 inches. Cool the victim down. Do not use alcohol rub. You just read the management. Okay? And then we have next is heat stroke or sunstroke, a response to heat characterized by extremely high body temperature and disturbance of sweating mechanism. Signs and symptoms: excuse, raised body temperature above 102 degrees Fahrenheit. Dry, hot, red skin, dark urine, small pupils, rapid shallow breathing, extremely confusion, weakness, seizure, and unconsciousness. So your first aid, cool the victim down. Do not use alcohol, rub still, and give first aid for shock. So elevate ang leg, something like that, and all. So we will now proceed with how to prevent heat emergencies. So we will not tackle those others some reminders ha. Avoid exposure to direct rays of the sun. Keep head covered. Wear proper clothing. So light colored clothing reflects rather than absorbs sunlight. Sweating cools only as sweat evaporates. So wear loose clothing. Intake of much water, 12 to 15 glasses a day together with extra salt. Exposure to air current from fans or open windows aids evaporation and cooling down. Okay, do not give the victim. Okay, you have to read na lang some reminders, especially for heat stroke. Do not give anything by mouth to a patient. Okay, how to pull the victim down and all. So, kana siya. Now we are on your medical emergencies. Medical emergencies na ta. Okay. We will not tackle all these medical emergencies anymore because we will have this one in our elderly. Just like your thrombus and embolism. Hindi na po natin ano yan. Seizure. You just read your notes na lang siya ha. So common emergencies and all. Now we will proceed with your emergency rescue and your transfer. Emergency rescue and transfer na tayo. We will just skip the others. So we have there as your emergency rescue, it's a rapid movement of patient from a safe place to a place of safety. So indications for emergency rescue, we have danger of fire or explosion. We have danger of toxic gases or asphyxia due to lack of oxygen, serious traffic hazards, risk of drowning, danger of electrocutions, danger of collapsing walls. So those are the things that we're going to make you decide to perform rescue. Methods of rescue, we have now your for immediate rescue without any assistance, drag or pull the victim in the direction of the long axis of this body, preferably from the shoulder. If possible, minimize lifting or carrying the injured person before checking for injuries, unless you are sure that there is no major fracture involved of his neck or spine. So, ang gamitin nato is only your dragging or pulling the patient. And then we have transfer is moving a patient from one place to another after giving first aid. Transfer na. Nature of severity of the injury, so you have to transfer. Size of the victim, dako, mabuni problema in transferring ha. Size of the victim, dako siya kay sa rescuer. Physical capabilities of the first aider, di kay kabalo ang first aider. Number of personal equipment available, so kinahanglan, kita ka ni wala. Nature of evacuation route, distance to be covered, and sex of the victim is the last consideration. Kung babae siya, then lucky ka, so you have to consider that. Especially when it comes to drugging. Pointers to be observed during transfer. Okay. So one is, ano po? Victim's airway must be maintained open. Then hemorrhage or bleeding is controlled. Victim is safely maintained in the correct position. Regular check of the victim's condition is made. And then supporting bandages and dressing may remain effectively applied. So tapos na mo ang bandage. Tapos transfer na natin siya. The method of transfer is safe, comfortable, and as speedy as circumstances permits. The patient's body is moved as one unit, and the taller first aiders stay at the head side of the victim, and first aiders bearers must observe ergonomics in lifting and moving of patients. So, dapat may, ano ba yun? Snappy ba? Snappy siya. Methods of transfer, we have one-man assist, carries or drugs, assist to walk, carry in arms or cuddle, pack strap carry, piggyback carry, firearm carry, fireman's drug, blanket drug, armpit or shoulder drug, cloth drug, feet drug, incline drug, head first passing when passing a stairway. While two-man assist or carry, you have assist to walk, forehead seat, hands as a leader, chairs as a leader, carry by extremity, fireman's carry with assistance. And of course, we have three-man's carry, bearers alongside for narrow alleys, hammock carry, 4, 6, 8-man carry, blanket demonstrate the insertion, testing, and lifting of the blanket, improvised stretcher using 2 posts with blankets, empty socks, shirts, and coats, triangular bandage, commercial stretchers, ambulance or rescue van, other vehicles necessary. Common command, we have there your command use. We have your preparatory, ready to kneel towards the patient's head or leg. So the executory, the per people or the rescuer would say really. Then automatic, they will going to kneel. Hands over the patient, ready to insert. And then pag sinabi nating ready to insert, sabi na ready. Okay. Pag sinabi natin, hands over the patient, so move. And then, pag sinabi natin ready to insert, so ready, automatic insert na. And place patient on your knees, ready to lift. Then, sabihin, ready, then lift na. Then, patient's body press to the chest, so ready, then press na. Okay, then ready to stand. Pag sinabing, ready, then stand na. And leg head center. So move, ready to walk, inner foot first, ready to walk, then walk. Ready to stop, ready. So automatic mag-stop na siya. Face center, move on your knees and rest or kneels. Ready to unload, ready, then automatic unload na po. Okay. Excuse. All team members must answer ready after the leader gives preparatory command. Likewise, leader shall only give the executory command for all members answer ready. Pag walang answer si members na ready, di po mag-execute ang leader. It is difficult for the inexperienced helpers to lift and carry a person gently. They need careful guidelines. If there is time, it wisest to rehearse the lifting procedure first using a practice subject. Yes, dapat mag-practice ha. Okay. Now, we have now your initial triage and tagging. So, you will recall that the primary survey has 3 steps that involve checking the victim's airway, breathing, and circulation. You will also recall that the secondary survey has 3 steps also. 3 steps, which includes we have intervening the victim, checking vital signs, and interviewing the victim, checking vital signs, and of course, doing head-to-toe examination. So through this approach, it is appropriate for one victim It is not effective when there are fewer rescuers than the victims. Okay. If you took the time to conduct each of these 6 steps and to correct all problems that you will found. Your entire time could be spent with only one victim. A victim who is unconscious and not breathing, excuse, and not breathing simply because the tongue is blocking the airway could be overlooked and die while your attention is given caring for someone with a less severe agency, such as broken arm. To identify which victim required urgent care in a multiple casualty incident, you use a process known as triage. Triage. Or, si tawag sa triage ha, another term for this is sorting. So triage is a process used in sorting patients into categories of priority for care and transport based on the severity of injury and medical emergencies. Okay, so we have this one, you're going to have your the start of the triage system is one method of triage that has proven to be effective. Patient's evaluation is based on 3 primary observations that RPM, respiration, perfusion, and mental status. Under this system, patients are tagged for easy recognition. So we have the tagging here. Priority 1, we have the red tag. And then priority 2, we have the yellow tag. So pag red tag, immediate care, which is life-threatening. Yellow tag, delayed care, can delay transport and treatment to 1 hour. Priority 3 would be green. Okay, hold care can delay transport up to 3 hours. Okay, while your priority 4, that is your black. No care required patient is already dead. Okay, start. Simply triage and rapid treatment. There, remember? Respiration. What do you mean by sinabi natin start? Simple, triage and rapid treatment. While you remember RPM, respiration, perfusion, and mental stuff. So, those are all with our emergency management 2 or the rescue and your transfer. So do not forget to like and of course subscribe para mo run ang video. Okay, thank you IHL. Salamat sa tanan.